Well, HealthPoint has been around for a number of years, 51 years, and our mission is to strengthen communities and remove barriers, and we believe that everyone deserves great care. So when we say everyone deserves great care, how do we know who everyone is?
Healthcare delivery is extremely complex. Every patient that we see is not only a unique human being, but has unique characteristics, has unique health conditions, has unique concerns, and has unique opportunities for their health and improving their health.
Data, information, and analytics is first and foremost how we try to organize our decision making to make sure that that patient-provider interaction is as effective as it can be. Currently we service about 110,000 patients in any 18-month period. So not only do we think about analytics and how it impacts our one-on-one interaction with providers, but also how do we think about allocating resources to deliver the best health outcomes at the population level, right, at scale.
I think that's where data is so important, and being able to take that data and transform it into information that will help us then understand who we're taking care of and then develop strategies that are specific to that population. For example, we know already that diabetic patients and hypertensive patients are the main group of patients that we take care of. But is that the same across the board? So being able to have stratified data and being able to look at how does that data changes when we add a language filter, for example. Are we addressing an issue in a different way for a different group of patients? So being able to have access into specific information is going to be key and reduce those disparities in care for our patients.
So there's several ways where that impacts our care. One of the things that already exists is having data around, say, our diabetic patients. Who's controlled, who isn't, and how are we doing as clinicians when we're taking care of people? The more specific we get in that information, the more that we can actually reach out to individuals and hopefully make the care better for them. The other way is around understanding gaps of care. So what we hope to do in the future, and we've started to do quite a bit of already here at HealthPoint, is understand gaps in equity and how does that impact our patient populations. Are we taking good care of our refugee patients, people of color, people different backgrounds of all kinds? If we can identify those gaps, then it helps us understand how we can better care for those populations.
It will also help us be more fiscally sustainable by having access to financial data. It helps us see where the total cost of care is, for example, what services our patients are receiving from other organizations, how effective is that care that they're receiving from specialists, for example, hospitals. And so having that information about our patients and our patients' cost of care is absolutely crucial as we consider new locations, new access points, or expanded services.